Jeff, this is good to go? Okay. As Gail mentioned, I work part-time for Aging Partners. It's kind of my retirement gig, which your next presentation will talk about keeping busy in retirement. And we have also a full-time person there who does the same thing as I do, counseling in financial and insurance matters. Insurance for our demographic tends to be Medicare, since we serve people 60 years and over. And as Gail mentioned, there's no charge for our services. We're actually a city-based agency, and the 8 surrounding counties contract with the city to provide the same kind of, it's mostly social services. So please visit our website and see all the other wonderful things that Aging Partners can provide you or your family. Medicare was piggybacked onto the Social Security Act. Under FDR, of course, he brought in Social Security, and LBJ added Medicare and it was an amendment to the Social Security Act. That's why you sign up for Medicare at the Social Security office. It's completely different from turning on your Social Security retirement benefit. But it's confusing for no good reason, like most things about Medicare. 65 or older, although a few people can get early Medicare. People have been receiving Social Security disability income for 24 months, they can get early Medicare. When you decide to segue from your work insurance to Medicare, you're going to be at a crossroads that you need to pay careful attention to, which I hope the reason will become apparent as I visit with you today. What I'm calling original Medicare, and it is called original Medicare, but it's called option 1 in your brochure that's called Medicare Basics. So option 1 is original Medicare. It's the red, white, and blue card, A and B from the government, and then from private insurance companies, filling in the gaps with a Medigap or Medicare supplement, same thing, and a Part D plan. Those are 2 things from private insurance companies. Those 4 parts put together the way Medicare always was until they started coming in with this, they've named for no good reason, Part C, Medicare Advantage plans. Advantage plans are a privatization of Medicare. It's private for-profit insurance companies administering your Medicare. You still need to have A and B, so you have to get those, but then they're wrapped in with a Part D plan and some other benefits into an Advantage plan. That's kind of a one-size-fits-all, or one product takes care of all of your Medicare needs. And I'll compare and contrast the differences of those as we go through. These are the 2 parts that are from the government, A and B. A is hospital, B is doctors. The Part A is covered, it's a hospital if you're entered there as an inpatient. You can be in the hospital, you can have the gown on, you think certainly sleep there or not, and certainly think you're in the hospital as an inpatient, but many people, if not most anymore, are actually listed on their record as outpatient or for observation. That's unfortunately a very important distinction in terms of Medicare benefits. And there's a lot of pressure on doctors to not be listing people as inpatients. The Part B will pay for the regular doctor visits that you go to, and then also emergency room, and anything that's durable medical equipment. Even if you go to a pharmacy and get insulin test strips, that's actually, the pharmacy will bill Part B, not Part D as in dog or drug, because it's considered a piece of equipment rather than a medication. That important distinction about being an inpatient, because it makes all the difference about whether Medicare will pay if you need to go from a hospital to a skilled nursing facility for a while for some rehab, like Madonna or Tabitha, for instance, here in town. Medicare will only pay for that if you were listed as an inpatient for 3 midnights in the hospital and then have to go to the rehab. Otherwise, if you're discharged or if you're listed as an outpatient and you still can't go straight home and take care of yourself, unfortunately, it is self-pay unless you had that inpatient status. This, no, this is the skilled nursing facility benefit. The home health care has its own provisos. In terms of whether you are or you aren't, you need to pay attention, or even when you're sick, or your family needs to be careful about whether you're listed that way. They do now require that you have to give this moon notice. I'm sure it has nothing to do with hospital gowns, but yeah, they have to tell you, are you an outpatient or not? That doesn't do a lot of good if you still can't get it covered. In terms of what you pay, there is 0 premium for Part A. That doesn't mean it's free, it just means we've paid in advance. You know, our FICA taxes that are taken out, our payroll taxes, most of that goes to Social Security, but a small slice of it goes to Medicare to pre-fund your Part A benefit. And that's why it used to be that it was just a no-brainer. If you turn 65, even if you're continuing to work, why not pick up Part A? Because there's no premium. And that glitch that Gail referred to is a way that the IRS and Medicare has not gotten their act together to coordinate. It's not fair, but it's the way it is still. There are deductible and co-pays for Part A services, which you can fill in with private insurance, as we'll discuss in a moment. Part B costs, the standard premium this year is at $135.50. Each fall, Congress looks at that and decides whether to raise it or not. If you're receiving Social Security, there's a thing called a hold harmless clause, so that if you have Social Security and there's no COLA, you know, that's that cost of living adjustment that bumps up Social Security, they cannot increase your Part B premium. They can't reduce your Social Security. They could grab a COLA to increase the Part B, but they can't raise it the Part B premium such that your Social Security net would go down. That's why sometimes you're going to hear, oh, my neighbor is an elderly lady and she's paying $110 or $109 or something. That must mean because she was grandfathered into this cap that they have on raising the Part B premium. The other things affecting that Part B premium, and by the way, last year it only went up $1.50, so it's not like you can expect this to be galloping up higher. There'd be too much backlash, I think, because we're our strong demographic, our age group are. On the lower income level, there are ways to assist with that Part B premium. We have many clients at Aging Partners who are lower income, and one of the first things we do is screen for these Medicare assistance programs. Everyone's heard about Medicaid, but there are also levels that allow income and assets above Medicaid that can help pay this Part B premium, and we are happy to screen folks and help them apply for that at Aging Partners, as well as you can get help from the SHIP program or from these government agencies. On the other end of the income spectrum, just know that there is what's called an IRMA for Part B, income-related monthly amount adjustment. Did I get it? I did, okay. They look 2 years back at your IRS return. And this is the chart for this calendar year. So if a couple earns $170 or less, then they're just on that standard Part B premium. But as you can see it going up with the income, there is an IRMA tacked on top of the $135 standard amount. That changes every year though. If you are subject to an IRMA, you'll get a letter late in the fall that, hey, for the coming calendar year, we've looked 2 years back at your income tax and you're going to be paying this IRMA tax on, or premium on top of the standard. But they'll adjust that every year, because many people have a higher income going right into retirement, and then it may level off or go down. The premiums for Part D range, they're much less than the supplements and the Part B, but they're this year between 15 and that 94. There's also co-pays and deductibles at the pharmacy counter. So, don't think that all of your medical services are free once you get to Medicare. We get that once in a while. Why do I have to pay anything? I'm on Medicare. For covered charges, it pays 80%, the government part, the A and B, that red, white, and blue card. There's no cap on your 20% copay. That's where we look to private insurance companies to help pay that. And the original Medicare, that is called Option 1 in your basics brochure, that does not pay for routine vision, dental, hearing, and foot care, or foreign travel, which so it's not like everything is covered. So here's that crossroads that I was talking about. You need to decide when you first go on Medicare, are you going to go the original route, which is to add from private companies a Medicare supplement policy? That's where you're looking to help offset and pay most of those 20%. And a Part D prescription drug plan. What those will come to, including the Part B, as in boy, doctor premium, those are going to average out per person. There's no such thing as family Medicare. Per person, it's going to be somewhere in the range of premiums of totaling $250 to $300 a month. As you look ahead budgeting for your insurance costs in retirement, just keep that figure in mind. And that's what I call front-end loaded. In other words, yes, you've got those charges up front, but when you go to use medical services, you have very little out of pocket. I'm not going to say zero, but often it is zero. The other way to go is sort of a pay-as-you-go approach. That's the privatization of Medicare Advantage, which I am referring to as back-end loaded. You'll see these heavily advertised, especially during what's called open enrollment, which is that every fall you can look at your Part D drug plan, and you can, if you're on an Advantage plan, you can look at that for possibly changing for the coming year. They are advertised heavily, showing that why would you want to pay more, why would you want to pay for a supplement. We'll throw in some maybe dental care, maybe a gym membership, some other bells and whistles, and charge you $20 a month. So they will say, why not do that? I'll get to in a moment. If you go the supplement route, this is why you need to kind of make this decision carefully when you first go on Medicare. I'm not going to say you never could change back and forth between, but it's sometimes not possible, and it's very narrow window that you could change back and forth between an Advantage plan and a Medicare supplement. The reason is the supplement has a window of 6 months, and it's 6 months from when? It's from on your red, white, and blue card. Your Part B doctor's benefit is going to have an effective date. That effective date starts the clock ticking on that 6-month guaranteed issue right that is a one-time in our lifetime, that we have a right to say, I want to buy this supplement from this company, and you have to give it to me. You cannot medically underwrite me. You can't ask me a bunch of health questions. All you can ask is my zip code, gender, age, and tobacco. They can ask tobacco use. That's it. Otherwise, you have complete control over getting a supplement that you can't be turned down, and which one you want, which I'll talk about the different kinds on that purple sheet, and the sheet that has the chart on the back. Now, because this is kind of a one-shot You can apply later, but they can underwrite you, they can turn you down later. So that's why when you pick this, I'm going to suggest that you not only shop for price. Part D, the drug plan, shop for price. You don't have any allegiance. You can change in a year if you don't like it. But on the supplement, think about a long-term commitment where maybe you couldn't get a supplement from another company. So think about other things like the company's financial stability, which is reflected in its AM Best rating. AM Best is an outside rating agency that comes in and audits insurance companies' financial records, and they give a grade to them. What I would recommend as someone from the insurance company business, that you do business with a supplement company that has an AM Best rating of A- or higher. A-, A+, A++. Indicates that, and with an outlook stable. They'll say that sometimes on the best rating. There's also an outside rating agency called Standard & Poor's. So when you see a quote tool, which I have access to at Aging Partners as a SHIP counselor, sometimes you'll see an S&P rating as well. Many companies don't want to pay for both of those because they have to actually pay the audit to come in. So I'm not concerned if a company has no S&P rating, but it should have an AM Best rating, and I would suggest A- or higher. So you do have the front-end premiums, but then very little, not no, but very little out of pocket. Another feature of going the supplement route is you have choice of providers. Any doctor that accepts Medicare must accept your Medicare supplement. So that goes with it. Because remember, the supplements, you're 20%, and Medicare's your 80%. So the doctor has to make a decision. Do I accept Medicare? Then they accept the supplement. Another plus about the supplements is it follows you anywhere. It goes anywhere in the US and these other territories. So it does not follow you to foreign countries other than, well, none, actually. I guess Guam is a foreign country. Is it a territorial or protectorate, or anybody know? Okay. Anyway, it'll follow you here. You don't have to change companies if you move to Arizona or you travel to Oregon, for instance. The supplements I mentioned are standardized. If you flip the purple sheet over to the back and you'll see the chart. These are the standardized supplements that are sold in Nebraska in 2019. And along the left-hand side, those are services for which you may have to pay 20%. If you had no Medicare supplement, you'd be paying 20% of those things on the left-hand column. A check mark means that that particular standardized supplement pays it for you. So we usually say, if you ask our advice, well, let's look at a supplement that has a lot of check marks. Obviously, the premiums go up with more check marks. We used to suggest an F as in Frank or G as in George because they tick every box. The only difference is a G requires you to out-of-pocket pay each calendar year the doctor deductible, which for this year, for the whole year, is only $185. And the supplement company will keep track of that for you. Obviously, in the world of insurance deductibles, that's a small amount. If you go to a doctor at all, the lower premium for a G is going to more than offset that $185. But more important is Medicare is closing Plan C as in cat and F as in Frank at the end of this calendar year. Closed plan will mean that you can't buy it anymore. You cannot go into those plans. And it actually would not be wise to hurry up and get in one, because what's going to happen? It'll be a closed block of business, and there'll be no new, younger, healthier people coming into that risk pool. So what's going to happen to those insurance premiums? They're going to we anticipate that they're going to be squeezed higher at a faster rate than normal inflation, which is maybe 3 to 6% in premiums. So a G is what we've been suggesting since we heard about F closing, which is a couple of years ago. It's not a requirement, it's your choice. And another one to look at if you want to lower the premiums is like Plan N as in Nancy. That's just like a G, except that you pick up these excess charges. Part B, excess charges means if a doctor accepts Medicare, they are saying, I'll take what Medicare pays me, a set amount for this service. But if they really think they're special, which a lot of specialists think they are special, they can say, I'm not going to accept assignment of the Medicare set amount for my service, because I'm so great, I'm going to charge more. But they can't go more than 15% more. So if you got, for instance, a Plan N, you would be agreeing to pay that if it's charged. The Part D, the drug plan, remember I said for the supplement, think long-term, don't just shop for price, just the opposite on a D. It'll be a different company invariably than your Medicare supplement. Don't think that there's any advantage to linking those together. You can change those every year if you wish. During open enrollment, middle of October through the first week in December, you have a right to look at your Part D plan for the coming calendar year and change if you wish. You don't have to. If you do nothing, you don't have to take any action. You'll just stay in the same Part D plan that you are in. But every year, early in October, all of the prescription drug companies have to load their data onto Medicare.gov into their plan finder. And they have their charges and premiums and co-pays for the coming year, as well as the charge for each drug. So a drug might be one price at a certain company with a certain pharmacy, and a different price if those variables are changed. For those reasons, it's wise to, particularly if you're on a number of meds or expensive meds, even one expensive one, to review your Part D coverage. And and SHIP and there's other services take many, many appointments one-on-one during that open enrollment period to help you review your plan. And you can also go on Medicare.gov yourself. They have just revised the website in a major way for the first time in many years. So I've gone to some training already, and we'll be doing some more, learning how to work that. It's supposed to be more user-friendly, but of course you have to open an account and make a password and a username, just like we have to for every single thing we do anymore. So that can take a little more time, but it is streamlined, and hopefully will be a good website change as we go forward. Another thing that is possible during that open enrollment period is to change the Advantage plans, but it is not a time where you can just hop back and forth between original Medicare with a supplement and an Advantage plan approach. Remember, original Medicare is A and B from the government, a Medicare supplement, private company, that you only have that one guaranteed issue right for, and Part D as in drug. Yes, at the back?
Pat, once you choose your annual provider for Part D, do they lock your cost then for that year?
The question is, do they lock your cost for the year? And yes, they do. So they are committed during that year. Good question. Both for the premium and also the drug cost during the year. I'm 90% sure about the drug costs. Yes?
Could you repeat the data of the website for the Part D plans?
They asked about the website name. It's Medicare.gov. And when you go on that website, there's going to be, the home page is going to say Find Drug Plans, or Find Drug and Health Plans, because you also can shop the Advantage plans. And it's going to lead you through after that. And we're happy to have you come in, bring your list of meds, sit down with you one-on-one, and there's no charge. We always accept donations, but we're happy to help do that review, particularly if people have challenging high-cost drugs. There's different tiers. Have any of you heard tier 1, tier 5 drugs? The more sophisticated and unusual, or not, the rarely used drugs go up in tiers and are way more expensive. And believe me, if someone has a cancer diagnosis or insulin, those can, even with a Part D plan, can be a daunting amount of copay per month. Because remember, on this, you can get the insurance for the drug coverage, but that still doesn't mean that you don't pay. I mean, I'm double negative. You still pay a deductible if they have one, which this year could be from $0 to $415, and a copay. And the copay may be, it's usually a percentage, like of about 25%. Has anyone heard of the donut hole? It's all about percents. On a drug plan, you start out, if they have a deductible, then you pay 100% until you meet the deductible. Then you go into what's called initial coverage. That's generally 25% that you have to pay at the pharmacy counter. And then once your total drug costs get to a certain amount, I think it was 3,000 some this year, you enter into what's called the coverage gap, also not fondly known as the donut hole. That's all, remember, it's only about percent. Same drug, same purchase, same pharmacy, but your percent pops up. Now, part of the ACA, Affordable Health Care, Obamacare Act, was to close the donut hole and get rid of it. Last year, they did take it away for the generics, and this year, supposedly, it's going to be gone for the brand names. So if that's true, then you'd be paying that 25% on up to, I don't even want to try to explain how it's calculated. It's a true out-of-pocket cost, it's called a troop. But there is mercy when you get to a certain point of out-of-pocket costs. You still go into what's called catastrophic coverage, which is then your percent drops back down generally to 5%. Sorry to go into so much into the weeds on that, but we're happy to work with you on the prescription drug costs. But again, you have no loyalty to any company. You get to look at and shop it around every year if you wish. So, front-end loaded, original Medicare is going to be $250 to $300 per person per month for premium. And the Advantage plans that are privatizing, you still have to have A and B, so you're going to have that Part B prescription drug, or not prescription drug, Part B doctor premium of that $135 and a few cents. But you'll have everything administered under this Advantage plan through the private company. They may have extra benefits, and this coming year they're allowing the Advantage plans to throw in even more extras. It used to be they'd throw in some dental coverage, maybe they'd have vision, some over-the-counter medication allowance, a certain amount per month or quarter. They might throw in some transportation to the doctors. I do not know how these are going to translate into actual dollars. Time will tell, and again, these plans are not standardized unlike the others, so it's up to you if you go this route to compare and contrast on your own. It's kind of the wave of the future. There's more percentage both in Nebraska and certainly nationwide each calendar year. I don't know if it's because they're better or it's because they're so heavily advertised. I don't know. But the other factors to consider about Advantage plans is that, again, you pay as you go, so that's back-end loaded. Every time you use medical services, you're going to have co-pays. They have a cap on them. Some of them, again, not standardized, but I know of the current plans available in Nebraska, one of the plans has a $4,900 annual out-of-pocket cap, and one of them has this $6,700. That's if you do what? You can't just go to any old medical provider of your choice who takes Medicare. You must use in-network doctors for that particular Advantage plan. And it's up to you to make sure every provider is in-network. If not, you'll pay 100%. So another issue on this is the doctors completely are in control of whether they accept a certain Advantage plan. If they accept Medicare, they've got to take your supplement. But they can pick and choose. I will accept United Healthcare Advantage plan, but I won't accept another one. And it depends on really their billings office's experience with getting claims paid. So that's something that you need to talk to your doctor about in advance. Also think about specialists. I had a client who needed to see an endocrinologist, could not find a single one in the local area network who would take her Advantage plan. So that was an issue for her. I know Mayo Clinic, which many of us in this area go to, accepts some but not all Advantage plans. So think ahead when you make this choice. And also that annual out-of-pocket cost, if you suddenly get a cancer diagnosis where you're going to have high medical costs, and you start hitting these caps, if you divide those by 12, you're going to have a lot more per month than you would pay for a Medicare supplement premium. Another issue to consider in picking an Advantage plan, which is cheap on the front end, is travel. They're based on service areas, networks in that localized area. So often there's no coverage if you are, say, you're visiting someone in California and you have an accident. It would often pay only the emergency room visit, and then you figure out how you get back to your service area to have follow-up care. I know the United Healthcare Advantage plan does have some rules that they've come out with for people who are snowbirds, who have really two homes, to where they could move to get coverage in another place. But these are all the rules about what you have to do in advance, and that's just a lot of rules. And if you don't have the coverage. But also, it wouldn't cover things like just while you were traveling within the U.S. or visiting. These are counties that this year do have no Advantage plans, and I think that'll go down this coming year. I don't know how many counties will have them added. So, just to compare premium costs, again, you're going to need to make this choice. Remember, we saw a $300 at the total premiums for the supplement approach, and Advantage plan is much cheaper. You still have to have, well, this is an old figure, it's the year before, but it's $135 now. But your Advantage plan this example has 44, that's really kind of on the high side. So you'd have a lower front-end cost. When you go to have a claim, however, if you use medical services, this is a sample, an actual sample done by the SHIP office, not me, of what an actual claim would look like under an Advantage plan with the lower out-of-pocket. So you'd have, these would be your co-pays along the way. Your out-of-pocket for this calendar year would be this. And then if you had the original Medicare with a supplement, you would pay, remember, this is a Plan G, so you'd pay that first $185, remember that's the deductible, and then zero. So the difference here in terms of all your out-of-pocket costs, not just the premiums, in this particular example, the supplement plan comes out about $1,400 less for that calendar year. It really just depends on your assessment of your health and your travel plans and your risk choices. I'm not going to tell you which way to go, but I'm just suggesting think about it before you use up that 6-month guaranteed issue right. Because say you had a supplement and you didn't like the service or the premium was going up too much, you can apply to another supplement company later on, but then they can underwrite you and ask you all the medical questions, can rate you a higher premium, higher risk, or they can turn you down. In terms of what you do when, again, more complicated than it should be, but we're here to help. The benefits people are here to help. The enrollment starting out, again, for the reasons that Medicare was just tacked onto the Social Security Act, that's why we sign up at the Social Security. That is different from starting your Social Security retirement money starting. In fact, 65 is still the trigger age for Medicare for you to be able to get Medicare, whereas our full retirement age for Social Security income, I believe for everyone in this room, is going to be 66 or maybe 66 in a few months. So that's creeping up. Once we are signed up, it's administered by this agency, CMS, with which you'll become very familiar. You'll get your quarterly reports from them, Centers for Medicare Services. Now, work insurance. There's a brochure in your packet that says Medicare and work insurance. A lot of people, a common call I'll get is, I or my spouse is turning 65, in 2 months. Don't we have to do something? We just feel like we have to do something, and we're very uncomfortable if we do nothing. It used to be no reason not to get the Part A. Why not? And that was good advice at the time before this HSA issue came up, the health savings account, which is a terrific deal. But probably, how many in this room already have Part A? Yeah, it was good advice at the time. I mean, it was what information people had at the time. But you will not be eligible to sign up or start an HSA account. I don't know, Gail, if it'll come up again, and hope the reason is they say you can't do, the IRS says you can't do that if you participate in Medicare, and they're counting Part A as participating in Medicare. So if you have work insurance, which that's what's called creditable, and certainly the university's health insurance is creditable, means is at least as good as Medicare, then it pushes back all your enrollment deadlines. Why? Because Medicare doesn't care if you have work insurance a few more years, and many of our university clients must enjoy working here because we often get people working past 65. What they want to avoid is you waiting till you're sick and then say, well, now I want Medicare. That's called anti-selection in the insurance biz, and it's not how the premiums are set. It's trying to pool everyone's risk together. So if you do not have the work insurance, creditable coverage, and you just wait past 65 to sign up, then you have an issue. You can only do it at certain times of the year, and you'll have a permanent additional penalty premium, which is like 10% for every 12 months you could have had Medicare, but you didn't.
Is that a one-time penalty, or is that?
No, it keeps adding up as you add. The question is it a one-time penalty? And no, the longer you wait, the more the penalty adds up, and it's lifetime. Is that your question?
Yeah.
It's not a one shot you pay. No, you pay it forever, the penalty. They really want to discourage that signing up when you think you're sick. You can keep that work insurance, and it includes spouses' work insurance. We often have people who are, maybe you both work here at the university, and one of you retires, but the other one's continuing to work. You, the retired one, you could do two things at that time. You could switch over to Medicare, or you could stay on the university insurance. And actually, you could switch to Medicare anytime. And we're happy to help you, or we can refer you out to brokers we trust, we have no business connection with, to number crunch that about which way it would be most advantageous to you pocketbook-wise. If you hear someone say, my employer forced me to take Medicare when I'm 65, that could be true if it's a small employer. The reason is, when we're past 65, we tend to have higher claims and more claims. And so the government is just taking pity on the small employer who wants to offer health insurance, but who just can't afford to be having their claim history hit with those bigger claims in later years. Yes?
Is the ACA considered creditable coverage?
The ACA, Affordable Health Care Act, is also known as Obamacare, is really for people under 65, and then it's going, if you technically could have it past 65, but you're going to pay way more for it in premiums than you would for Medicare at that point. So it's going to be financially in your interest to switch to Medicare at age 65. Does that answer your question? Retiree health plans are not creditable. Has to be tied to active work. So timing. You want to apply for parts A and B, and you can do that if you're just turning 65, you can do that online. And you can come in and we can help you do it online because there's just some little tricks to it. For instance, you have to make a My SSA account. Here's 2 hitches with doing it online I've run into. You have to open up an account, username and password, and then to prove that it's you, the website will ask you make you pass a bunch of financial questions about your past, and about half of my clients flunk them. They are so fine-grained. It's like in 1985, was your credit limit $11,000 or $12,000? It's a really fine-grained. So, and if you flunk them, I think there's 5 questions, you're locked out for 24 hours. So that's one glitch with doing it online. Another one is, I just love this. You pass all the questions, you get your account open, you prove it's you go all the way through to, I just want A, or I want A and B, and then you hit submit. And submit is like right here on the screen. Does everyone know where I'm going now? So you kind of think, I'm done, right? Submit the application. But no, if you have to scroll down, and then there's a little button that says done. And if you don't scroll down and hit done, you have not applied for Medicare, and you can find out, like, oh my God, then you're in a time crunch. But you can also just go into the local office, and they really have a great reputation here in Lincoln. They've been very helpful. I've experienced that personally, and my clients have. It's on the 2nd floor of the federal building, over at 16th and O, I think it is.
Is that where the Social Security office?
The question is that where it is the Social Security office. Remember, because you apply for Medicare at the Social Security office. So that's an option. If you have worked past 65 and you've kept your creditable insurance with University Insurance then don't try to sign up online. Why? Because you can't prove online that you had that creditable coverage. There's, guess what, some forms you have to fill out. Gail's office has them, my office has them. It includes the benefits department's signing a statement that yes, you've had work insurance from this date to that date. So what I advise, you can then fax or mail those in. What I advise is hand carrying them, because you want to start this process. You figure out when your university insurance is going to end. Say July, end of, I never know what month. How many days in June? 30? Okay, say June 30. So your target date for all the parts of Medicare to start is July 1. So I just always establish that target date with a client and then work backwards from there of when you do what. First you apply for A and B, or just adding B if you already have A. And you have to, if you're past 65, you've got to prove it. And then you decide, do you want to fill in the gaps with an Advantage plan or a Medicare supplement and Part D? And to do that, a supplement, I, as a SHIP counselor, and Norm, who comes into the benefits department by appointment, is also a fellowship counselor. We have access to a quote tool that you will not have access to, that's the same exact as any insurance broker in the state has, that shows every company that sells the Medicare supplements, what they charge, what their AM Best rating is, what their market analytics is in terms of history of premium increases. And we can print all that for you. It's usually 12 pages, and point out some factors that you might want to consider in selecting. Remember, not just selecting for price on the supplement. So we're happy to help you, or we can refer you. We can't actually sell it to you, even though my colleague and I are licensed agents. We aren't contracted with any companies, which is to keep us totally neutral. But we can refer you, if you don't have someone to buy it from, to some brokers that we have had good experience with, no financial connection with. Then a Part D, you can do that within 30 days before that target date. Remember in my example, July 1st. So within 30 days on Medicare.gov, as soon as you just click enroll in the Part D that you pick, and it will automatically, the Medicare website will send it to the company, and this company will send you a card and a packet, and it'll start the first of the following calendar month. Aging Partners staff is available for many social services. The financial and insurance is just a small slice of it. We serve the 8 counties closest to Lincoln, but statewide is the SHIP program. So anyone in any county in the state will have access to the same kind of counseling through SHIP. It's a program that's actually federal, but it's based in and they really have a lot of knowledge. Those of us who are SHIP counselors, they give us a full day of training twice a year, and we're going to have one coming up next week, actually. So I really admire that program, and they are the authors of the brochures that were handed out to you today. Are there any other questions? Yes.
Could you just go back one screen?
Back one screen.
Thank you.
My cards are on the table out with Diane, and it has my direct number on it. We are happy to do one-on-one appointments and follow through your own timeline on any of these. I'm part-time, my colleague Karen is full-time.
Are there any other questions? We've got about 15 more minutes if there's questions.
Okay, I don't have to talk very fast then. Okay, yes, sir.
Well, this may be very basic, but if we opt to continue the university coverage, what kind of plan is that? Or is that none of this? Is that not
If you go
something that-
past 65 and you're on work insurance here at the university, you don't have to worry about a thing. You've got creditable coverage. All of your deadlines are postponed, are just going back until you stop the work insurance. You may, if you're 65, pick up that Part A hospital because there's 0 premium. Remember, it's prepaid. However, it will bump you out of being eligible to open an HSA, health savings account, which is a very fine thing financially to be able to have. So I laud the university for offering that to you.
But I mean, then we retire, so now and then the university has special rates to,
So is your question if you stay on the university health insurance?
Yeah.
It's the same health insurance that you would have as an active employee, but you're going to be paying over $500 a month for single coverage compared to approximately $300. You'll still have the same deductibles and out-of-pockets and stop-loss limits that you would have as an active employee. And it's not credible coverage for Medicare. So if you decide at some point that you do not want to pay for the university retiree insurance anymore, then you're facing a penalty for every year that you did not sign up for Medicare.
So I guess what I'm saying is, and I noticed that the premiums for the university plan are tied to whether we are in Medicare or not, right?
That the premiums for the university plan are cheaper if both you and a spouse, if there's two of you, are both Medicare eligible and you are on Part A and B.
I guess
So
what I'm
then we
saying-
act as the supplemental in a
I
way.
guess my question is,
Correct.
in effect, the university becomes the supplemental, right?
Yes, it's not looked at like that by Medicare, but yes, in effect, that's what it's still doing, yes.
And it's also effectively picking up Part D to the extent of prescription.
It does pick up Part D, that is correct.
Okay, thanks.
That's a good question, but I wouldn't recommend it.
I wouldn't either. It's not a very economical option, and we have retirees that made that decision several years ago, and now they would like to get off, and they're facing that penalty to enroll into Medicare.
Plus, they've used up their.
Their 6-month window to
yeah,
enroll, yes.
Their guaranteed issue.
Yes, ma'am.
Dental coverage from the university.
We'll talk about university benefits towards the end, and we'll get into the dental coverage.
That's a good idea,
Mhm.
in my opinion.
Yes,
The
ma'am.
dental coverage at the university.
The timeline for, you said the 6-month deadline. Is that 6 months before you move from university health insurance to Medicare and supplements or whatever?
What, the question is about what is that 6-month running from? It's running from the effective date of Part B as in boy.
So when you sign up for Part B, you have 6 months to.
Uh-huh. And you actually you don't want any gap. You don't want 4 months gap. I mean, if you have A and B from the government starting on July 1, in my example, you want everything, your Part D drug plan and your supplement to also start July 1. Because if you're in a car accident July 4th, you're going to pay 20% of that hospital bill.
So how long before July 1st do you need to start the process of signing up?
Well, we used to say 90 days before your target, in my example, July 1, to apply for A and B, 60 days for a supplement, and 30 days for a Part D as in drug plan. Now, that's not a requirement. It's just to, avoid those heart-stopping, last-minute running around. I have actually gotten calls from clients who say, my insurance runs out this Friday. Is there anything I should do? No. And the first thing I say is, come over here right now, and it's not fun. Yes?
When you're choosing your Part D provider or who to go with, is your spouse separate? So if you each have your list of medications, can they be different?
Oh, absolutely. The question is, can you and your spouse have different Part D as in drug plans? Absolutely. You almost surely will. And oftentimes when our appointments, a couple comes in together with their separate drug plans, or list of drugs, not plans, and then we put those in, and an answer for one might likely be as different from the answer for the other one.
I think that's a big mental shift for people. You've gone through having family health insurance and then employee and spouse insurance, and now you're completely individual. And I think that is a shift that is very different for people to grasp as you're moving on to Medicare, that it is completely different. But some people enroll at different times, and so
Right.
that helps aid that shift. Yes, ma'am.
So, just for instance, the insurance from the university is coming up to renew for next year. Say we retire, I've already got Medicare, Part A. I want to retire next year, say in June. I can wait until that time to change to the Medicare, or is it better to change to the Medicare supplements and Part B now and start taking that January 1?
Okay.
I would say that there are two schools of thought on that. So,
Repeat the question.
oh, I'm sorry. Sorry.
She's
Yeah, I've
always
trained
telling
Pat
me
to
to
repeat the
repeat the
question.
question.
So the question is, if we've got January, we've got open enrollment, we've got January coming up for insurance renewals. But if you retire mid-year, and you're already 65, should you get on to Medicare January 1, or should you wait until you are retired mid-year? I think there are two different schools of thought. A lot of people that come to my office that ask a similar question that are looking at retiring early in the year, I encourage them that if they're good with moving to Medicare as of January 1 to do it, because then they're not meeting all of our deductibles and out-of-pockets. And so it does, and you can disenroll from the University Health Plan during our open enrollment. But you have to be on the ball with your timing with that, because like Pat said, the advice that we see is that you're looking about 90 days ahead of a January 1 effective date to start enrolling in your Medicare A and B and then start your supplemental shopping. Our open enrollment is October 28th through November 15th. That's only 45 days out from a January 1. So you have to be really on the ball with your dates and your targets, because you don't want to have that lapse of coverage, because when you disenroll in university insurance during open enrollment, we don't offer you COBRA. You just eliminated that possibility of staying on our coverage. So you just have to have your ducks in a row if you do that, but it may save you money in out-of-pockets and deductibles by not having to meet them with the university and then move on to Medicare, and then they don't count for anything. Does that help?
So in other words, if I would want to do that, I better be doing it now.
Yes, if you want to do that, you should be thinking about it now. That is absolutely correct.
That 90 days ahead is not a rule. It's just how to do it without any stress on your heart, right?
It's stressful enough, believe
Right.
us. Yes.
If I retired at age 64 and a half, and I can't get Medicare till 65, can I do like the COBRA for 6 months?
So the question is, if he retires before age 65, 64 and a half, can you do COBRA for 6 months? Yes, and we'll talk about premiums and all that on the university plan when I present a little bit later, so I'll give you more details on that.
However, once you're 65, COBRA is not creditable.
Correct.
Yeah, well,
Ahead of time,
changed to Medicare when I was
right,
65.
right.